Hello, I'm Dr. Praveen Tripathi. I'm a consultant psychiatrist and sexual disorder specialist. Today I want to have a brief discussion about a very common sexual problem, which is erectile dysfunction. Let's try to understand this problem in brief. So first of all, what is erectile dysfunction? So, an inability to either achieve erection or maintain erection required for sexual intercourse is called as erectile dysfunction. So if you look at it, there are two components to this definition. First is either the person is not able to achieve erection, or even if he is able to achieve erection, he is not able to sustain it long enough to complete the sexual intercourse. So how common is this problem? How many people suffer from it? Erectile dysfunction is a fairly common problem, and it has been estimated that almost 1/3 of males will have this problem once in a while. It has been found that as the age increases, the prevalence of erectile dysfunction also increases. Let's talk about the common causes of erectile dysfunction. So before that, we'll have to understand how does erection happen. Whenever a person is sexually excited or aroused, the blood flow into the penis increases, and that increase in blood flow results in erection. The problems that cause erectile dysfunction can be broadly divided into the following categories. The first category is the disorders that limit the blood flow into the penis. So we understand that there is a blood vessel, there are blood vessels through which the blood goes into the penis. If any disorder decreases the width of these vessels or results in a blockade in any of these vessels, that interferes with the normal blood flow. So that can result in erectile dysfunction. For example, a person who has been having high blood pressure problem or hypertension for many years, or somebody who has been suffering from diabetes for a long period of time, in these people it has been found that the thickness of the blood vessels or the area or the lumen of the blood vessel that tends to decrease. That can result in decreased blood flow, and that can further result in poor erection. Apart from the blood vessel, the second common cause that can result in erectile dysfunction is the abnormalities of the nerves. So there are nerves which regulate this blood flow and which are responsible for the erection. So if there is some abnormality which is causing dysfunction of the nerves, that can again lead to erectile dysfunction. Again, people who have been having long-standing hypertension or diabetes also develop disturbances of the nerve functioning that can result in erectile dysfunction. The third common cause is use of medications. There are many medications which can cause sexual side effects. The psychiatric medications, including the antidepressants and antipsychotics, they can also result in erectile dysfunction, which is a side effect of these medications. Finally, what we call as psychogenic ED. Now this term psychogenic ED is quite misunderstood. Psychogenic ED does not mean that there is some stress that is resulting in the erectile dysfunction. Rather than that, let's take an example to understand what is psychogenic ED. Say there is an individual who attempted sexual intercourse tonight and he was not able to do it. When this person in question tries having intercourse tomorrow or day after tomorrow, the fact that he was not able to do it previously, it plays heavily on his mind. During the act, instead of focusing on the partner, he keeps on thinking, what if I am not able to achieve erection today also? What will my partner think about me? Will it result in a lot of embarrassment for me? So when these thoughts cropping up in the mind, instead of getting excited, he becomes anxious. And in that state of anxiety, the erection is lost. So this is what is called as psychogenic ED. After understanding the cause, let's talk about the treatment. How do we treat it? Now, we must understand that erectile dysfunction is a medical problem, and we must treat it with medically proven ways. A lot of people, out of shame and embarrassment, tend to take medications from people who are not qualified enough, and many a times they go to the relatives or the friends and take tips from them. In these individuals, either of the two things happen. First, either they take spurious medications or medications which are not approved for the treatment, or they end up using medications or methods which are not effective, and the treatment gets delayed, which further has its own consequences. So before talking about the treatment, I want to advise all of you that if you have such problem, go and meet a medical professional. Now when you talk about the treatment of erectile dysfunction, it is fairly straightforward. There are medications which are called as phosphodiesterase 5 inhibitors, which improves the blood flow into the penis. You must have heard of medications like Viagra. So these are the medications which have been found to be quite effective in the treatment. But please remember, medications like Viagra should not be used over the counter. It's a common practice that people go to the chemist shop and ask for medications. This should not be done. Simple reason, because these medications are not for everybody. They can cause side effects, and the side effects can be as serious as loss of vision. Now newer medications have come and they are much safer with much lesser side effect, but nonetheless you should never take medications without the approval or without the prescription from a qualified medical practitioner. Apart from these medications, a lot of nutraceuticals have also come up in the recent years, and they fall more in the category of natural medication because they are usually derived from the natural sources. But again, just ordering a medication from internet or taking it from a chemist should not be practiced. Even for the nutraceuticals, you should have a valid prescription. In the end, I would just want to tell you that erectile dysfunction is a common problem. It affects almost 1/3 of the males and it is easily treatable. So don't waste time, don't fall prey to the shame or embarrassment. Meet a medical professional and get treatment as soon as possible. Thank you.